So the main goal of any health response in a humanitarian crisis is to reduce mortality and morbidity arising from that crisis. Key aspirations in doing that are elements of cost effectiveness, feasibility, timeliness in the response, maximising the opportunity benefits, minimising the opportunity costs of any response in order to achieve overall coverage and effectiveness of humanitarian health responses. We also need to ensure that there's strong coordination between different sectors, for example between the health sector, water, sanitation and hygiene sector, education, protection and shelter. There also needs to be a strong emphasis on community-based responses to really activate resources through the primary healthcare system, while also supporting hospital-based responses. There also needs to be strong coordination of the humanitarian health response. So that means working through the national government and local government where that exists, but also working through the cluster system, for example through the health cluster, both nationally, locally, but also globally. Well, particularly there's concern around communicable disease, and especially disease outbreak, such as measles, meningitis, and particularly cholera. But we also have concern around the impacts on mental health, non-communicable disease, sexual and reproductive health, maternal, child health, injury and rehabilitation, and also nutrition. Key risk factors for these outcomes include exposure to violence, causing mortality and injuries, but also causing stress, which leads to elevated mental health disorders. We're also concerned about interrupted health services for treating these health conditions or maintaining treatment for conditions such as HIV/AIDS, tuberculosis, or indeed non-communicable diseases. Other risk factors include interruption of food supplies, which are critical in maintaining health, particularly amongst children and infants. Living conditions such as overcrowded housing and shelter, or indeed lack of shelter altogether, which can lead to conditions such as pneumonia or the spread of vectors of disease. Fortunately, there are a number of guidelines that can support health responses that almost all the humanitarian agencies have signed up to. So for example, with HIV/AIDS, there are guidelines that support the coordination and provision of services for HIV/AIDS. Similarly, there are guidelines for gender-based violence. There's also specialist packs for particular health topics. So with reproductive health, there are something called the MISP, the Minimum Initial Service Package, which provides a list of key activities and services that are required to support good sexual and reproductive health in crisis-affected settings. There are similar guidelines for nutrition, for disease outbreak. However, there are not really any guidelines for non-communicable disease, and so this is something that the humanitarian agencies are currently working on. There isn't time now to go into all the different health service responses for the different health needs. And the table in the briefing pack provides the key principles and key actions that are required for the different health topics, and also the range of guidelines that exist to help agencies respond to these health needs. Well, while there are a number of key priority health topics that have been identified across different humanitarian crises, these inevitably need to be adapted to suit the different context of humanitarian crises. For example, whether it's a conflict, an armed conflict, or whether it's a natural disaster and the type of natural disaster, for example an earthquake or a flood. It could also vary by the type of population that have been affected. For example, whether they're refugees that have been displaced into refugee camps, or whether they've been dispersed into urban areas, or indeed whether they remain in the most affected areas and trapped in those affected areas. Similarly, different contexts will have different underlying epidemiological, socioeconomic and cultural context, which will influence the type and appropriateness of different humanitarian health responses. So there really needs to be a strong local understanding and gathering of information to ensure that those responses are most effective for that particular context. So examples of these different types of crises include the current crisis in Syria, where we see large numbers of people that have been displaced into neighbouring countries such as Lebanon, Jordan and Turkey. And they're living in very different conditions in those countries. Some are living in well-organised camps, for example in Turkey, while others are dispersed in more urban areas, for example in Lebanon. That creates a whole different sets of challenges and problems for humanitarian agencies in identifying those populations and responding to their needs. In addition, those populations carry a high burden of non-communicable disease, which presents new challenges in how those agencies can treat those conditions and maintain treatment and access to medicines for those conditions. This is in contrast to other conflicts that we've witnessed, for example in sub-Saharan Africa, where much of the burden of disease was around communicable disease, and the real fear there was around disease outbreaks such as cholera, which has killed hundreds of thousands of people in different examples in the past in sub-Saharan Africa. In addition, we should be acutely aware of how responses need to vary over the different stages of a humanitarian crisis. For example, at the early stage of a crisis, in the more acute stage, mortality may be high due to direct causes from the fighting itself, and then also from disease outbreaks such as cholera. Mortality that may then be reduced as things stabilise, security stabilises and health services are strengthened. And there we need to be more aware of the longer term needs of affected populations, such as longer term reproductive health needs, adherence to long term treatment methods, for example for HIV/AIDS, tuberculosis, non-communicable disease. In more prolonged situations, we can also think about strengthening the health services and providing a larger range of more comprehensive health services. My answer would be yes. Clearly, the nature of the type of information will vary over time. In the first few days of a crisis, the only information that can realistically be gathered is looking at existing data on that population that may help support those needs. Then after a few days, it may be possible to do what are called rapid assessments using existing data sources, but perhaps also visits to affected areas, interviews with community members, even the use of satellite imagery to understand the size of the affected population or the scale of the impact on that population and its infrastructure. And then as things stabilise, perhaps after a few weeks, much more detailed information can and should be collected. For example, this could include conducting mortality surveys, nutrition surveys, vaccination coverage surveys, to understand the impact of the population on health needs. And importantly, surveillance systems should be established as soon as possible in order to be able to track disease outbreaks, mortality, nutrition outcomes, vaccination rates and so on. And the priority should really be to establish these surveillance systems as soon as possible. Without collecting this information, we really have no idea of the overall health needs and, importantly, how effective these health responses have been. One area that's received increasing attention over the past few years is the role of health systems in humanitarian crises, and particularly how we can support health system strengthening in a humanitarian crisis, and particularly shortly after humanitarian crises. It may seem difficult to even think about a health system in the midst of a humanitarian crisis, but the evidence suggests that the earlier we can engage in health system strengthening in a crisis, the more positive outcomes are for the health system overall at the end of that crisis. And what this entails is thinking not just about health services, but also other key elements of a health system, which includes things like human resources, medication and other supplies, health information, financing, and also governance. And the more we can engage and support all of these elements of a health system, the stronger and more sustained the health response will be, and the greater the improvement in health outcomes over time.